You're looking at Dr. Sue Cornbluth, psychologist and professor of psychology at Temple University, a voice for abused and neglected children. Interesting. You've done a lot of research into this field, foster children. Who are they? What do they face?
Foster children are children that come from very abused and neglected homes, mostly. And the challenge that they face mostly is that they need help to be successful in life.
What do you mean?
I mean, when they are put into the system, they are scared, they are full of fear, they are full of panic. They need to meet somebody in their life where they can bond with in a healthy way, that can see the light in them, can see the desire, can see the passion to be successful later on in life.
What caused you, Doctor, to be so interested and concerned about foster children?
Yeah, I often struggled with that for a long time myself, finding out why. And then I remembered a time in my life, I must have been 9 or 10 years old, and my parents had a terrible fight in the home. And my mother ran out and slammed the door, and she said, I'm leaving. And I ran to the door. I said, no, Mom, no, don't leave. You know, and I went back in, and I was sitting on the step, and my father was trying to console me, was saying she would be back. But in that moment, I felt so much fear and panic that I wondered, was my mother ever coming back? And she did come back an hour later, and she's never left again since.
Did you ever tell her what that felt like?
Yes, many times. And she apologized to me many times. But
So these children we're talking about,
yeah.
their mother doesn't come back in an hour.
Right. So that is the most scary and horrific feeling a child sits with. And they don't know what to do with all of that emotion going through them. And so they bottle it up inside and they stuff it down because it's so painful or even shameful to talk about.
How does it manifest itself?
It manifests itself a lot of times in aggressive behaviors, you know, getting in a lot of fights at school, being disrespectful in the home to their foster parents, and also not being able to bond with the new foster family.
Because?
Because they grew up in such a dysfunctional environment where they learned what we call in psychology is a dysfunctional attachment, where there was no give and take. You know, I often refer to it as an attunement dance.
An attunement dance?
Yes. And it's when a child cries and the mother or the father comes in and consoles them. And the mother and the father feel great because they were able to soothe the child. And the child feels great because here's Mommy and Daddy giving me warmth. Well, a child that grows up in a neglected or abused environment, there's none of that interaction. The child could be laying on the floor screaming for hours, days. There's no attachment.
So let me ask you, government policy as it relates to foster children, what is it, what does it need to be?
That's a great question. You know, I can only talk really for the state of Pennsylvania because that's where
obviously Temple is in Philadelphia.
Right, and you know...
Is it state by state?
It is state by state.
So it's not like there's some national federal legislation that supersedes any state law with respect to foster children?
No, Department of Human Services in each state has different mandates and policies.
What is it in PA?
In PA, you are mandated to, when you come into Department of Human Services, they are now mandated to place you in a temporary foster home or group home with the goal of reunification.
Got it.
What I think they need more of...
Yeah, let's talk about improvements.
Yeah, exactly. Which is lacking is in terms of training and education for foster parents and for child welfare workers.
Okay, back up.
Yeah.
What do you need to do, what do you need to be a foster parent today?
And in each state, again, it is different.
In Pennsylvania.
In Pennsylvania, you need to be 21 years of age. Yes, you heard me, Steve, 21.
21.
21. You need to pass a criminal abuse background check, a child abuse background check, people living in the homes, if they suspect that there's a problem, they have to go through checks. However, Here's one check they don't go through, Steve.
Which is it?
That's a psychological evaluation.
Oh, come on.
No, I'm serious.
To be a cop, you have to have a psychological
Absolutely.
evaluation. To be a foster parent, you do not?
Do not in the state of Pennsylvania.
Is Pennsylvania's law, I don't expect you to be an expert
Yeah.
on what's going on across the country, do you think that's the norm?
I think it's the norm in government systems, but in private sectors,
Yeah.
like private agencies that take on foster parents, they do the psychological testing.
But the government, through children's services, whatever, because of different names in different states,
Yes.
you're saying that is not in place in Pennsylvania.
It is not in place in Pennsylvania.
What's the logic behind that? Because lawmakers in Pennsylvania, the executive branch, the judiciary, what do they say?
Well, when I brought it up in
Do they say you don't need it?
they said you don't need it only if we suspect. Now, how
How would you know?
Exactly. That's what I've been saying. How do you know if somebody needs a psychological exam without a psychologist doing a psychological eval? Because people are really good at hiding
Sure.
things. And then when these kids get in these homes, that's when you see the behaviors.
Hold on. Pennsylvania, it hit me right now. By the way, the ambiguous foster child attachment, separation, loss, and loyalty. Dr. Sue Cornbluth, this is some research that you put together. By the way,
Yes.
Tell us what this is, because I want to ask you a quick
Okay.
Penn State question after this.
Okay,
Go ahead.
this is a training manual that I wrote and published this year on how to train foster care workers and child welfare workers across the country.
Anyone can get it if they if you log on to our site, we'll hook you up with Dr. Sue. Do you mind if I call you Dr. Sue?
I love when you call me Dr.
Because
Sue.
you wind up having your own show called Dr. Sue.
I might, you never know.
How about this? Jerry Sandusky,
Yeah.
are those foster children, adopted children, what?
No, they were, some were foster and some were youth that,
He had foster children. Some of his children are foster children.
his children were adopted children.
Okay.
I thought you were talking about Second Mile.
Oh, Second Mile, it doesn't even exist anymore.
Correct.
But here's the thing.
Yes.
If a Sandusky
Yeah.
wanted to become a foster parent,
Yes.
are you saying in the state of Pennsylvania he would not have had to go through a psychological...
If there was a report, like,
No report.
no, he wouldn't have to. Unless they suspected in an interview with the department that he may have had some mental issues.
We are talking about people who are expert at... we have a long way to go.
Yeah, we got a long way to go, but it starts with education. We got to educate our parents, we got to educate our teachers on how to talk to our children about abuse.
You care deeply.
Very. I am passionate about making change, and I'm going to do it.
Well, listen, that is why we are here. I just want to remind folks that the piece that Dr. Sue Cornbluth has put together is called The Ambiguous Foster Child Attachment, Separation, Loss, and Loyalty. Dr. Sue Cornbluth, psychologist and professor of psychology at Temple University. I want to thank you so much for joining and coming up all the way from Philly.
Thank you so much, Steve.
Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child. Wells Fargo, the law firm of Gibbons PC, PSC&G, committed to improving New Jersey's economy and strengthening its communities. And by Barnabas Health. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato.